Hello, welcome to today's presentation, Medicare, What You Need to Know, presented by Kristi Caracappa, Health Insurance Information Service Coordinator with Washington Health. Kristi has served the Washington Township Healthcare District since 2009. She provides information to community members to assist them with making informed decisions regarding healthcare coverage. Please welcome Kristi Caracappa.
Hello, thank you for the introduction. I am Kristi Caracappa, Health Insurance Information Service Coordinator here at Washington Health. Thank you for joining us today for this Medicare presentation. First, I'd like to talk to you a little bit about the service that's provided here at Washington Health, the Health Insurance Information Service. It's a free and unbiased service available to all community members, and we're here to answer all your health insurance questions. We're here 5 days a week at Washington West at 2500 Maury Avenue, and it is an unbiased service, so we help people with all different health plans, for example, Kaiser, Sutter Health, wherever, as long as you're within our township. So what we're here for today is to talk about Medicare a little bit, to find out what the ins and outs are, how to get started, and how it works. So Medicare is a federal health insurance program, and it provides health care coverage for people generally over the age of 65 or those of any age with certain disabilities. Also, people with end-stage renal failure are typically put on Medicare. So who is eligible for Medicare? So first of all, if you are in the 65 range, those who have worked in the United States for 40 quarters or 10 years. Those who have paid into Medicare, and to know if you are on the radar for Medicare, you can get an account with socialsecurity.gov, and it will tell you whether you're eligible and when it will be available to you. So Medicare is, again, federal, and it is initially through Social Security. It is then, after you sign up through Social Security, then Medicare takes over for all your information. But you start out at ssa.gov. If you are already receiving your Social Security benefit, you took it before age 65, then usually you're automatically signed up. You should receive your Medicare card before you turn 65, usually 3 months before. Initially, when you sign up for Medicare is usually when you're 65. So you would be eligible to sign up within a 7-month period, which is 3 months before your birth month, your actual birth month, and 3 months after your birth month. There's another enrollment period called special enrollment, and that is for those who perhaps didn't sign up for Medicare during their initial enrollment period when they turned 65, because they're covered under a group health plan based on your own or a family member's insurance plan. And then there's general enrollment, which runs from January 1st to March 31st, and of each year that you could sign up for Part A and B. And general enrollment typically falls into place for those who either forgot to sign up, didn't want to sign up at all, missed their other enrollment periods. This is the time that they would be able to sign up. So why would you delay your Medicare? Some people choose to delay their Medicare Part B. If you are covered under a group health plan based on your current employment or those of a spouse, you have a special enrollment period to sign up for Part A or B. And you could sign up anytime you're still covered by the group health plan or during the 8th month period that begins after your employment ends. But the important thing to remember is that it has to be related to your current or your spouse's current employment. So for example, if you leave your employment and your employer offers you COBRA at no cost and you decide to take that and it's an 18-month period, you have 8 months to sign up for Part B. If you go past that 8 months and you try to sign up, then there will be a penalty. And also, after the 8 months, you'll have to do the general enrollment period, which is just going to delay your health care for a really long time. So let's talk about the different parts of Medicare. Medicare A and B, as you see here, there's your Medicare card, and you have your Medicare A and B, and these are the effective dates of those when they start. And with that, you want to add on to your Medicare with a Part C Advantage Plan, and also you would need to get drug coverage, and let's talk a little bit more about how those work. So here are your Medicare options. There's two roads you can take. There's the original Medicare side, which we're going to talk about now. And then after that, we'll talk about Medicare Advantage, also known as Part C. So if you remember again, we have Parts A and B, which is your Medicare card. And when you're on Medicare, you're always going to need both of these. And then we have Part D, a drug plan. If you don't sign up for Part D when you're initially signing up for Medicare, there is a penalty. You can get it later, but there would be a penalty involved. Just like Part B, if you didn't sign up for B when you were eligible, there's a penalty down the road. Again, the caveat is unless you're covered under a group plan. And then we have supplemental coverage, and you want to get supplemental coverage to cover those extra parts of A and B, and we'll talk about those. So we're going to talk a little bit about the differences between original Medicare and Medicare Part C Advantage plans. So with original Medicare, this is the big part. You can use any doctor or hospital that takes Medicare anywhere in the U.S. with the original Medicare. If you go with Medicare Advantage or Part C that groups your insurance all into one bundle, in many cases you can only use doctors and other providers who are in the plan's network. So there's more limitations on this side. The costs, Part B covered services, you usually pay about 20%. And on Medicare C, your costs are going to vary. They're going to vary by plan. There's approximately 25 plans in Alameda County, and each one has its own set of rules and out-of-pocket costs, and also premiums. And I'm not going to go through all of this, but there's no yearly limit with your original Medicare and a supplement, and there are yearly limits with the Medicare Part C. Now, we're going to go back and talk about original Medicare with a Part D plan and a supplement. There's a lot of letters within here. These are supplement plans, also called Medigap plans. And in our area, not all the plans are sold, but the ones I recommend are Plan G and Plan N. And the reason is, first of all, Plan F you can't get unless you turn 65 before 2020. So some people will continue to work after 65, and if they're still working, they retire, when they're 70, whatever, and they turn 65 by 2020, they could still go back and get Plan F. The only difference between the two plans is this one little hole right here, which is the Part B deductible. Part B deductible is $257 a year, and after you pay that, it's just like F. Now, it's always best to choose the highest plan when you first enter Medicare. You could always go down in coverage, but you can't go back up. So if you want to start out with Plan N, it has some holes in it. You have to pay a co-payment at some of your doctor visits of up to $20. You also have a Part B deductible, which you also have in G. And then there are Part B excess charges, which are charges that perhaps a provider doesn't take Medicare assignments. So there might be extra charges there. So I always recommend you start out with Plan G, and if you get comfortable, the premium starts getting too high, usually around 75 to 78, you might consider dropping down to Plan N, depending on the usage that you're using the plan. So Part D, prescription drug coverage. So you have, with Medicare A and B, it does not cover prescription drugs. It does cover, Part B covers drugs that are given to you at the doctor's office or an outpatient setting, such as chemotherapy or given injections within the office. Those fall under Part B. But so you need Part D, something that you can use when you pick up your prescription drugs. And there's lots of plans offered through private insurance companies that are approved by Medicare. They have to be approved by Medicare in order to meet the coverage and avoid the penalty. And depending on your coverage, usually you pay a monthly premium. This year, I believe the lowest cost monthly premium is about $1.40, and it could go on up to $150, but it's really based on what medications you're taking. Most people are usually in the lower range, between the $1.40 to maybe $50, again, depending on the medications you're taking. And it's important to remember that even if you're not taking any medications, that you really should get the Part D coverage So first of all, to avoid the penalties. Second of all, if something happens to you in the middle of the year and you need to start taking an expensive medication, at least you'll have a drug plan that will cover that. Okay, so with again, the original Medicare, I'm going to go back a minute. With the original Medicare, you have your Medicare A and B, which we talked about. You have your Part D prescription drug plan, and then of course you want to get a Medigap within there to cover the extra costs. Okay, choosing a Medicare Advantage plan. It's a little more difficult. You can find the Medicare Advantage plans on the website, which as we go through the presentation, I'll give you the website for that. And there's different plans available within your zip code. It's basically that's how they organize them. So here we're looking back at this sheet again, Medicare Part C, the Advantage plan. What it does is it takes your Medicare A and B, it also adds in Part D, and then it covers some extra pieces of Medicare. So just to go back, I don't believe I went over this already. Part A is your hospital coverage. Hospital coverage is when you're admitted to the hospital. It typically pays for the building, you being in a hospital bed, the nurses that come to see you, your food, and so on. Part B is all the medical things that happen. When the doctor comes to see you, the doctor is Part B. Any medications you're receiving in the hospital are Part B, surgeries, anesthesia, labs, imaging, so on, in the hospital are Part B. So you do need both A and B even when you're in the hospital. And there are extra costs to Part B, which is Part B is typically covers 80% of most services, and then it's on you to pick up that extra 20%, and there is no cap. So with your Part B, if you're going to you're over here and you're picking up, you're going to the doctor and you don't have a supplement, you're going to have to pay that 20%. With a standard doctor visit, it's not going to be that expensive, but once you start getting into labs, imaging, MRI, any infusions, and then if you go in the hospital, it could cost you tens of thousands of dollars. So you really want something that covers that extra part of A and B. So moving back over to the Advantage plan, with an Advantage plan, it has to cover at least what Medicare covers. So it's going to cover your Part A and B, but not that extra 20% all the time. It might have coinsurance of 20%, could be 10%, and it might have a set copay for each visit. For example, your doctor, you might pay $0 to $10 for a doctor visit. When you go to the hospital, sometimes with a Medicare Advantage plan, it will cover your hospital stay, but you might have to pay a copay per day. Those copays could be as high as $350 a day, up to 7 days. So it can get expensive. But you have one plan. So basically with your Medicare Original, you're going to have 3 cards. You're going to have your Medicare card, your red, white, and blue card. You're going to have a Part D prescription drug card, which is going to be from a private company such as Humana, WellCare, multiple companies that carry those. You're going to have that in your wallet, and then you're going to have a supplemental card as well. So you're going to have 3 different cards that's going to pick up your Medicare. And then over here, you're going to have 1 card. You still pay for your Medicare A and B, but you're going to put that card away, because what happens is once you sign up for a Part C plan, they let Medicare know that they're going to be taking care of you. And so you put that card away, your new card, your Medicare Advantage plan, such as a Kaiser card, a AARP card, whoever you're purchasing from, it could be Anthem or Blue Shield, whoever you're purchasing it from, you're going to use their card because they have now taken over for your Medicare, all right? Now, we'll talk a little more about the Advantage plans. They're offered, just like the Part D, by private insurance companies that are approved by Medicare. You no longer use your Medicare card and you receive a card from the Advantage plan. It's a bundle. They have to cover at least what original Medicare covers, and the Medicare Advantage plans offer extra coverage sometimes, such as vision and dental. And they all can charge different out-of-pocket costs, so you really need to research each one and how they're going to work for you and your medical needs. And the out-of-pocket cost and additional coverage can change each year. So every year during open enrollment, which is October 15th through December 7th, you want to reevaluate your Medicare Advantage plan. You want to make sure that your doctors and hospitals and where you get your services are still in that Advantage plan. If they're not, you could change Advantage plans or you could change providers. So the questions again to ask when you are choosing an Advantage plan is what medical groups are included in the plan. Oftentimes, plans will be sold in Alameda County, but you have to go as far as Castro Valley to San Francisco to use the plan, so that could be inconvenient for a lot of people. You want to, if you have a favorite doctor that you've been seeing and you want to stick with that doctor, ask that doctor what Advantage plan that they are in and what hospitals are in the plan. Since they each have their own Part D plan, you want to find out if the prescriptions that you're currently taking and want to continue to take are still in that plan. And of course, what are the copays and coinsurance? And you also want to know what your out-of-pocket maximum is. So here's the website that I was talking about. It's Medicare.gov. It's a great website. It's very user-friendly. I use it all the time. This is the handbook where I'm getting most of these, the slides where you see the pages. This is where I get it from. It's a great handbook. And after this presentation, if you go online and take a look at this, it'll all be put together more for you. So Medicare Open Enrollment is October 15th through December 7th every year. And open enrollment is for Medicare Part D and Advantage plans. Oftentimes, especially recently, Advantage plans come and go from the area. Your Advantage plan can be dropped from an area and you're left going back to original Medicare where you pick up a Part D plan, and oftentimes it leaves people wondering, what do I need to do? That's what the service here at Washington Hospital, that's what I provide. I can help you find an Advantage plan or who to call to find an Advantage plan that works with your doctor. But it is important every year, whether you're on original Medicare or a Medicare Advantage plan, to take a look at your Part D or your Advantage plan. So oftentimes there's extra help. If you meet certain income criteria with resource limits, you can qualify for extra help from Medicare to pay for costs of prescription drugs, also sometimes for your Part B premium. You can find that information by calling socialsecurity.gov to ask them if you qualify, or you could also call Medicare, and that would be the number on the back of your card if you already have Medicare. It's really important to know about scams. Scams are coming across through social media that look like they're targeting you directly with great deals that look like great deals from companies. Also, on the phone, I know a lot of people are just tired of getting those spam calls, especially during open enrollment. It's a big complaint I get. I would not recommend that you engage in any phone call that you did not initiate. So if it sounds good to you, you can go online if they give you a name and check online to see if it seems reputable. You could call me, you could call Medicare and ask them about it. They will know if it's a scam or not. But always, if you did not initiate something, I don't think you should follow down that path. Don't give out your Medicare or Social Security number if someone calls you, or fill out a form through social media or any email that you get online. And be aware of phone calls and mailings that you did not initiate. Thank you. So that's all I have for today, and you're welcome to call me or email me if you would like to set up a private appointment to go over any of your Medicare questions or health insurance questions, and I will take questions.
Thank you so much, Kristi. I have a few questions. The first question is, can I enroll in Medicare even if I'm still working at a job that offers medical benefits?
Yes, you can still enroll in Medicare even if your employer is offering you a group plan. Most of the time, it's not beneficial for you. You can go ahead and sign up for Part A because it's free, but if you sign up for Part B, it is not premium free. Medicare Part B is $185 it's based on income. It goes up based on your income. I don't have the exact numbers, so you do want to check that out. You also, usually signing up for Part A is a good idea, then you're on the radar, and when you leave that employer, if you're ready to start your Medicare, it's very easy to get that B put on your card. But you cannot be contributing to an HSA when you take the A, so you need to look at that.
Thank you. The second question is, can I switch to an original Medicare plan if I start out with Medicare Advantage but find it too restrictive?
I'm glad you asked that question. I should have pointed that out in the presentation earlier. No, so when you first start out with Medicare, when you turn 65, if you're not covered under an employer's plan and you're signing up, and we have the two roads. You have your original Medicare or your Medicare Advantage. If you sign up for Medicare Advantage and down the road you decide that you you don't like it, it's too restrictive, you want to open it up more, you can drop your Medicare Advantage plan during open enrollment, that October-December time. You can drop your Medicare Advantage C plan, go back to your original Medicare, pick up a Part D plan, although you are not guaranteed to issue a Medigap supplement plan, and you will need that. The only time that you're guaranteed to issue in a supplement plan is when you first initially go into Medicare. You are guaranteed issue, so it doesn't matter what your health condition is. Otherwise, there would be underwriting involved, and most people would not qualify for a Medigap plan. Now, another time you can get back into that original Medicare with a supplement is if the plan leaves the area. So we had that happen a lot this year. Plans leave the area. If they leave the area, that opens you up to be able to get a supplemental plan. Or if you leave the area, for example, Kaiser is here very strong in the Bay Area, but they might not be so strong in the Midwest, and you move out there and there's no Kaiser, now it opens you up for that supplement. So it's really important to know for sure that you want that Advantage plan before you initially sign up for it.
This concludes our program. Thank you, Kristi, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.